measuring, indicating, computing, analyzing, calculating. Science serves commerce. Modern technology controls the heartbeat of industry. But these instruments handle more than vital data. These dials and digits meter the very stuff of which life is made. The commodities they compute are health and life itself. Installed not in the corridors of wealth, their currency is man, woman, child. Their operators, doctors, surgeons, and nurses. Surrounded by the trappings of day-to-day bustle, they form part of the remedial and research equipment that modern medicine needs to combat the conditions that today's pace produces. Many roads lead to this vast complex, which covers 53 acres. It's more than a hospital. It's a center of care, research, and learning. It is the most modern of its kind in this country. This is the University Hospital of Wales at Heath Park in Cardiff. A new life. And care begins here. A woman in labor while her husband waits and watches. But sympathy and concern are converted into practical help. For the Cardiff Infusion Unit also helps and announces each heartbeat of the unborn child and charts the way to a safe delivery. Within seconds of birth, the new infant is transferred to the baby warmer unit designed by the medical physics department to reproduce the human environment from which the infant has just come. When necessary, the first few vital breaths are helped to gain power with the aid of the Cardiff inflatory bag, again designed in the hospital workshops for the specialized needs of patients. Unfortunately, not all babies are blessed with such a good start. Spina bifida is a major problem in South Wales, occurring in 3 newborn babies in every 1,000 born. The effects are variable, but most of these children have weakness in their legs and many are totally paralyzed, being unable to walk or crawl. Such lives can be greatly enhanced by the development of mechanical aids to overcome the disability. Hello. This baby, who is hydrocephalus, has manipulative difficulties with her right hand. This is despite early and successful treatment of hydrocephalus, which is mild in degree. Although she may on occasion succeed when reaching for small objects, there is a tendency for her thumb and fingers to be incompletely extended. Children with this disease have a high incidence of reading and writing difficulties, and research is in progress to investigate the effects of hydrocephalus, which is seen in 60% to 80% of these children. Gifts of money, large and small, are required for this work. One area in which science has accelerated progress is in the investigation of body fluid or tissue, rather than the whole patient. The example is the hematology department, where this machine can examine a specimen of the patient's blood. These samples are from patients at the hospital and from the patients of family doctors. Within 40 seconds, a printout supplies the analysis. The machine carries out 4 separate investigations, which were previously carried out by 4 separate technicians, and automatically calculates results. The machine also enables the swift screening of populations at risk and can monitor the blood state of people with diseases such as leukemia who are undergoing intensive treatment, or those with bone marrow damage caused by drugs or industrial poisons. The strains of Beethoven relax the patient and mask a fantastic breakthrough. This equipment, the whole body counter, allows an estimate of the bone marrow function to be obtained in 24 hours. By the old method, it took 14 vital days. It can also be applied to acutely ill patients who in the old days simply could not undergo such study. The amount of radioactivity used is minute, but nevertheless, the entire measuring apparatus is enclosed in a steel room, leaving the patient at ease with wallpaper, steel, science, and music. The vital function of bone tissue comes into focus under the microscope of the professor of pathology. Bone changes greatly with age and with disease. And the loss of bone with old age is accompanied by a greater liability to fracture. To study this bone loss, measurements of the changes in the 3 main components, the marrow, the calcified bone, and the uncalcified bone matrix, or osteoid, have been made. With Medical Research Council support, the hospital has developed and built a color television system that enables some of these measurements to be made with ease, and could, with further development, be of great help not only in the study of bone disease, but also in the studies of industrial lung diseases, X-ray interpretation, and a wide variety of other problems. As hazards grow and life becomes more complex, so must medicine combine with science to produce the safeguards required in this modern age. Noise, part of today's scene from which it is difficult to escape. It's a part of industry. But some far-sighted firms are cooperating with specialists determined to minimize damage to the workers' hearing. Manufacture of the humble nail comes under audio scrutiny at a GKN factory. Pending legislation, the aim of these dedicated men is to set noise in factories at an acceptable level, or where this is not possible, to break down resistance to the wearing of protective earmuffs. Another requirement is the regular monitoring of the employee's hearing to detect any deterioration by ascertaining variations in the thresholds of hearing sensitivity. This is done by metering response to various levels of pure tone. South Wales has long been a centre for research into disease through inhalation. Here, attention has been turned to toxic constituents of factory dust. At the South Wales Forge Masters, amid the heat and fumes of heavy industry, samples of dust are taken. infinite care, the samples on filter discs are transferred for analysis. The outcome? Advice to factories. More and more factories are becoming aware of the risks and seeking such advice. The solution lies normally in the provision of effective ventilation or the wearing of masks. Most people at some time have experienced at least twinges of back pain. Its recognition and treatment are the subject of this lecture.
About cases of back pain. These cases were from industry, and research was done on them in this department. What we found was that where you have back pain, as in this left lumbar region, you get an area of increased skin tenderness called hyperesthesia. This is very useful to localize the pain, to see whether it's central, lateral, unilateral, or bilateral. And over here, this diagram shows an area before manipulation. Now, after a successful manipulation, the area will diminish down to a small patch like this, and then you know that the area, the manipulation has been successful. From now on, I just want to show you some pictures of the close-ups of these to show you the inner area and outer area of hyperesthesia, and the white cross marks the tender spot.
Coronary artery disease is the main cause of death in the Western world in men over the age of 40. It is not confined to the elderly. In Wales alone, where the incidence of the disease is particularly high, between 750 and 800 men and women under the age of 55 die every year from this cause. Disease of the coronary arteries leads to narrowing and eventual blocking of the supply of blood to the heart muscle. This X-ray from a 28-year-old man who had severe angina shows the almost total occlusion of one of the two major arteries supplying the heart. The treatment of heart failure after a heart attack is difficult, but it is made easier by its early recognition. This can now be done by measuring the pressure in the blood entering the heart. A special tube with an inflatable latex balloon at its tip is passed up one of the veins in the arm after local anesthesia. The pressure in the blood at the tip of the tube is continuously recorded. When the pressure recording shows that the tip of the tube is in the right atrium, the first chamber of the heart, the balloon is inflated. The tube is then carried by the flow of blood into the pulmonary artery. The procedure is painless and takes about 10 minutes. Research has shown that the lowest pressure recorded in the pulmonary artery reflects the filling pressure of the main pumping chamber of the heart, the left ventricle. Elevation of the pressure is the first sign of heart failure. The use of new techniques of this type, based on research, has helped the return to work of many people who might otherwise have died following a heart attack. After such an attack, however, great patience and skill is needed to assist the patient in a return to normal routines. A tie with a concealed loop is just one of the many ideas and aids for the physically handicapped. Here, rehabilitation consists of dressing practice and sitting balance in the early stages of treatment. In the workshops, the occupational therapist supervises treatment of patients using a bicycle fret saw and ankle rotator. Rehabilitation can make a considerable contribution to the industrial life of Wales. Many people at present unable to work could again take up regular employment. Hazards, of course, are not limited to those in factories. Atmospheric pollution grows, and modern medicine strives to counter its damage. This is the continuing story of medicine. Through the ages, men and women have devoted their lives in this cause. In Wales, there has been a long tradition of personal patronage to further the cause. Durable marble records the names of past donors. Their good lives on. Today, with your help, the University Hospital of Wales will become one of the great medical treatment and research centers of the world. This is our chance to build for the future.